Hi there, everybody. Welcome to What is Corneal Donation? We're going to go ahead and get started. Thanks so much for joining us on this gloomy day. I'm going to go ahead and start by saying that People's Memorial Association would like to acknowledge the traditional, ancestral, unceded territory of the Coast Salish, Duwamish, and Suquamish nations on which we work and live. Our office is physically located in the Queen Anne neighborhood of Seattle, and most of our staff lives in the Seattle metro area. Before we get started today, I do have a couple of housekeeping items for you. We're going to go ahead and keep all of our participants on mute for the time being, just to kind of cut down on that background noise. We're going to go ahead and record the presentation, so don't worry about furiously jotting down notes. You can always refer back to it later, and our presenter has agreed to share her slides, so I'll make sure you have a copy of those as well. If any questions come up for you, feel free to drop those into the chat box or use the Q&A feature. If you're a little bit shy and you don't want us to share your name or have other participants see your question, feel free to directly send your question to either myself or Amanda Stock, and we're happy to keep your identity secret. If this is your first time joining us, welcome. My name's Beverly, and I am the Communications Manager for People's Memorial Association. We're the oldest and largest memorial society in the United States. We are celebrating 81 years of service here in Seattle, and we're pretty proud of that. We're the only nonprofit in Washington that provides funeral education and advocacy. If you're joining us from out of state, don't worry, though we only serve the state of Washington, there's about 73 other similar organizations scattered around the US, all under the umbrella of the Funeral Consumers Alliance. So it's very possible there is another org right in your neighborhood doing some similar work. To date, we've had over 215,000 members, and of those folks, about 70,000 of them are still living. So our members keep us pretty busy on a day-to-day basis. And in terms of how we serve those members, well, one of the biggest things we do is education. We offer free classes like this and educational resources to help families make informed decisions about their death care and the services that they secure for their families. We're also a pretty big fan of advocacy, and we do some state-level legislative lobbying here in Washington to increase funeral choice, increase price transparency in the funeral industry, and protect everyone's rights to have death care that meets their cultural and social and emotional needs, not to mention their financial needs. That access to affordable cremation and burial, as well as aquamation and natural organic reduction now. We want to make sure that you're not unnecessarily going into debt just trying to do right by someone you love. If you're thinking, oh, maybe membership might be for me, well, you're in luck. Lifetime membership is only $50 per person, and that's a one-time fee. One of the biggest selling points for membership is that we have about 25 contracted funeral homes around the state of Washington, and we've pre-screened each of those folks to make sure they're running good, ethical, transparent businesses so that you don't find yourself with that sort of used car experience during one of the tougher times of life. And we negotiate price discounts for burial and cremation with each of those providers, and so there's no surprises, and you can do some pretty good planning ahead of time. We're also contracted with 4 cemeteries, a monuments company, a virtual memorial website, and a pet funeral home. So we're just kind of branching out and making sure we're covering as many needs as we possibly can. And we're also pretty proud of our member-owned co-op funeral home in Seattle, which is a pretty unique type of business. And I think we might be the only one in America right now. So that's pretty big point of pride for us at PMA. I'm going to go ahead and hand it over to our presenter for today. Rebecca Grossman is joining us from SightLife. She's a senior manager of family and community resources over there, and she is going to help us figure out what is corneal donation. Rebecca, welcome.
Thank you. It really is such an honor to be asked to present. So thank you so much. I think so highly of People's Memorial. So this is really an exciting opportunity. So I cannot, I need to share my screen.
I was just turning that off.
Okay, thank you.
All right, there you go. I'll go ahead and hand it over to your very capable self.
Thank you. So yes, as I'm going through my presentation, please do ask questions. I encourage you to do so, because then it will make me feel less like I'm speaking out in a void. So please feel free to interrupt me. I would do that if somebody else was presenting. But anyway, yes, my name is Rebecca Grossman. I am it's a very long title, the Senior Manager of Family Services and Community Resources. But basically that just means that I run our donor aftercare program at Sight Life. And I just want to stress today that I am going to be focusing on cornea donation. I think you had Mary Graff from Life Center. I don't know if any of you were there. She spoke about organ donation, but this focus is on cornea donation today. Oh, why am I not advancing? There we go. So I was talking to Beverly and Amanda beforehand that this is even though we've been presenting a lot, Sight Life, on cornea donation, this format is kind of new. And I kind of want to talk a little bit about why, using my own personal story with donation. So I've been at Sight Life for 9 years, working in the aftercare program, but it wasn't until pretty recently where I had direct contact with the donation process. So my partner, his aunt, who I'm going to call Aunt Bunny, because she really liked bunnies, about 2 years ago, she was tragically hit by a car while walking and was put on life support at Providence St. Peter's down in Olympia. And they were absolutely great. But being in the donation world, I had more of an idea of what was happening. And he is part of a very large family, so we're all down at the hospital, and I could tell where the conversations were going and what was being said to the family, that it looks like they were going to put donation on the table. And even though that option, and they were very pro donation, and even though they knew what I did, I all of a sudden got very protective of the family, and not protective and not letting them make their own choice, but just making sure that they knew what the next steps were going to be. Because something that I've always known is, while we're really good at pushing out why you should register, we don't really talk about, well, what does that process look like, so people can be prepared. So that really spurred me on to do presentations like this, so we can tell as many people how to prepare for donation and what that all looks like. So what this presentation is not, it's not going to tell you whether or not you should donate or not. That is your personal choice. And I urge you to really think about that and do what's right for you. That's not what today is about. Again, today is about, well, I'll tell you what today is going to be about. So today's agenda, we're going to be talking a little bit about what is cornea donation and why it matters. I think a lot of people know about organ donation, but organ donation is pretty uncommon. It's like about 1% of donation. Most of donation is cornea donation, and yet most folks don't know what that is. What the donation process involves, what does that look like? What's the donor registry and how and why you should access it? I hope you know the answer to this question. Does it help if I discuss my donation wishes with loved ones? I hope already you can answer that it's yes, it is helpful. And of course, how do I learn more? Because I have an hour, there's no way I can teach you everything that you need to know. So I'll point you in the right direction. So who is Sight Life? Sight Life is the world's leading nonprofit eye bank and global health organization dedicated to renewing hope and healing through corneal blindness prevention and sight restoration. So I'll talk a little bit. Well, actually, I'll go back. So we are an eye bank, and do a lot of domestic work here in the United States, in Washington State and Montana, parts of California, parts of Pennsylvania, and Wisconsin. But we also have an international program, a global program, in which we are helping other places in the world with their eye banking. So there is 12 million people worldwide who are corneal blind. That's 12 million. And the majority, the great majority of those people are living outside of the United States. And so we work really hard with other countries, other policymakers, so they can bring eye banking like we have in the United States to where they are. And what are some of the things that we do? We work with people with their government policy. Not everybody has such a great donation registration program like we do in the United States. Early intervention, what we'll talk about a little today is just how important it is. The earlier you can prevent some of the reasons why people need transplants, the better. We train healthcare providers. This is for the intervention and also for the cornea transplants. Making sure that there is quality eye banking. And then tools and innovation. What are some of those really great ways of bringing a better process? So again, we are based out of Seattle. We have offices in Pennsylvania and California, but here are some of the other areas in which we have programs and or helping others with their eye banking. Our mission is to eliminate corneal blindness worldwide by 2040. That is a really big goal. Again, there's about 12 million people worldwide who are corneal blind. So it's we feel strongly about it, that we're going to do that. Corneal blindness, and I'll go into a little bit about what it looks like and what it impacts, and you'll hear a story, but it makes it hard to stay in school, maintain your independence, and that is important, and to sustain a livelihood for yourself and for your family, if you have a family. And really importantly, it diminishes the opportunity and life expectancy in some respects. So it's important. So who is vulnerable to corneal blindness? So in the United States, and I'm gonna just back up for a little bit, but in the United States, if you need a transplant, there's no waiting list. So unlike organ donation, if you need a transplant, you can get a transplant, you can schedule one. But that's not necessarily so worldwide. What are some of the risks that would increase your susceptibility? A deficiency in vitamin A, limited access to protective eyewear. So, you know, you think about like the goggles or those glasses that people wear when they're doing construction or working in a factory. Those are so important because you could easily get like a metal splinter in your eye or whatever, and you would need you might need a corneal transplant. And then of course, in certain areas, especially if you do have that scratch, you could be susceptible to bacteria, fungal, and viral infections, especially in young children. And, you know, the way I'd like to think of that is, I don't know if you probably aren't aware of this story, but of course I am because I'm in cornea donation. But there was a woman who was doing one of those mud runs, And she scratched her eye, and because she was doing these mud runs, some bacteria got in her eye and it caused corneal blindness, which was an unusual way here in the United States, but this does happen often worldwide. Conversely, in the United States, it's mostly due to hereditary conditions. So things like Fuchs dystrophy and keratoconus, those are two things that cause corneal blindness that are purely just genetics. And then some other common reasons, but nothing like those other two are an injury to an eye. And sometimes like herpes or chickenpox, you can actually get that in your eye, and that also, well, it causes a lot of pain, and it also might cause corneal blindness. But definitely Fuchs dystrophy and keratoconus, top two. So what is a cornea? If you think about a contact lens, that's kind of the size and shape of a cornea. It's also where, if you think about where a contact lens is on the eyeball, that's also the location of your cornea. So it's that thin, clear outer layer of the eye. Some people say it's like the windows of your eye. It's not the lens, not the iris. It's like the window. When damaged or there's some sort of condition, it becomes cloudy, and that causes the blindness. And then this is an amazing statistics. Nearly 80% of corneal blindness is treatable and preventable. What's a cornea transplant? So this is a great graphic that shows what it looks like. So you can see there is a cloudy cornea. That's kind of what it looks like. As you can see, the window is fogged up. What happens in a full cornea transplant, the cornea is removed with special instruments, of course. Then the cornea from the donor is put in, and then it's sutured up. And on the right, you can see the great graphic of it. But a transplant, it does take a while. So like right after, like the day after a person gets a cornea transplant and it's outpatient surgery, sometimes what I've heard is, you know, you can definitely see some differences, but it takes a little while to fully regain sight. So it can take up to a year for someone to see the full difference. And if we were all in person, I would be able to hand out these glasses, these corneal blindness glasses that you put on and you can see what it looks like. But unfortunately we can't do that. But this is kind of a neat picture. As you can see, that outer part is fuzzy. You can see shapes, you can sort of see colors, but you can't see the details. And that's what it's like to be corneal blind. You can see light, you can see shadows, but you definitely can't see details. So I can sit here and tell you what it's like to be corneal blind, but it is so much better when you're able to hear from somebody who went through a transplant. So with that, I am, whoops, I'm going to try, I have to move this box. I am going to share a story. This is a recipient who we got in contact with because she was going to have a transplant, and she called up and she said, I want to thank my donor family for the cornea that I'm going to receive in 2 weeks. And because of that, we were able to follow her journey through her transplant. So introducing Gracie.
9 years ago, I noticed a significant change in my vision. It was a little harder to distinguish objects at that point, and it was then that I was diagnosed with keratoconus. I would say a matter of months after I was diagnosed, it started to get extremely worse. The most challenging thing I think for me would be helping my kids with homework, maybe. I've given up on new recipes for cooking because that's too hard. It's definitely taken a toll on my self-esteem. So I decided to go and see Dr. Rostov, and she basically said, you know, I believe you're a great candidate for a corneal transplant. You know, for once in 9 years, there was hope. You know, I could maybe be able to see again.
What's the very first thing you want to see?
My kids' faces. Every little detail of their face, every little freckle, if they have freckles, any birthmarks, any changes that they had that I missed. Just be part of their life like I'm supposed to be. I found Sight Life by asking my surgeon who was going to provide the cornea. Of course, knowing that I was going to come from a donor, I immediately felt for the donor family, and my heart went there first. I'll forever be thankful. That was a long day. A lot of nerves. Dr. Rostov explained what was going to happen. They walked me into a room where they did the laser part of taking my cornea out. After that, they walked me into the operating room. And during the surgery, I could see her stitching the new cornea in, so I can watch that as she was doing it. And the next morning, they went to take the patch off. I looked at the eye chart, and I could actually see the big E. I just lost it. I had the nurse crying. My boyfriend was crying, and right then, it was just confirmed that I knew everything was going to be okay.
You know what I think is great talking to you this time compared to last time is just the eye contact.
Yeah, well, I can see you now, so just taking in the leaves on the trees or an airplane in the sky, stuff like that I hadn't been able to see. I wish there was more of an understanding of how huge this is. I'm able to see today because of someone else.
So a little update on Gracie. Because of her transplant, she was able to go back to school, and one of her and her child, they were in school together at the same time, which I think was kind of cool. Also, some other tidbits that wasn't included. She would pluck her eyebrows by feel. And for anybody who plucks their eyebrows or has someone else that does it, just the thought of doing it by feel is incredible. And the other thing that I thought was really interesting is I had met her previous to the surgery and was there during her surgery. But then after, when we met again, or when we got together, she said to me, "Rebecca, it's so nice to see what you look like now." And it had never occurred to me that she couldn't see, number one, because she was really good at being able to navigate without that, but just again, the enormity of her condition. Cornea donation, of course, restores hope. health and healing. And I think there was a lot of that in that story of Gracie. Of course, with the gift of sight, there also comes a loss. Our donor families, we have a very thorough program that lasts 18 months for our donor families. My philosophy, Sight Life's philosophy about donation is it can bring some joy, not always, but it can bring some joy to the family. It does not and should not take away the grief. That grief process is very important to go through, and we respect that, and we can be a presence for that family. We do have a community if they seek it or want to be part of it. That is we really meet them where the family is. Any questions so far before I start talking about the process?
So I'm taking a look here and I don't see anything's trickled in just yet. So don't be shy, guys, if you have questions. There's a whole ton of information. It's hitting you like a wall of bricks right here. It's good information.
Okay.
Yeah, all right. I'll let you know. I'll keep my eyes peeled.
Thank you. Okay. So the journey of donation. So again, we're talking about cornea donation, which is different than organ donation. So cornea donation happens at cardiac death. So where it can start is either in a hospital, a hospice, at home, or some sort of accident outside of the home. For hospitals, it is mandatory that a hospital call in every single death, and that's a federal mandate that they need to call in every death to a donation agency. Does not matter if the person is registered or not, they need to call it in. That is not necessarily the case for hospices, although some do have programs that do call in the donation. They're not mandated like the hospitals. And at home or an accident, those are usually overseen by a medical examiner or a coroner, and they are not mandated either, but some do have programs in which they will call it in to the donation agencies. The next step is when that is called in, we call them transplant donor coordinators. They will look at the case and see, does it make sense to go forward with the cornea donation process? So something that we would say rule out a cornea donation would be perhaps the way a person has died. Certain cancers we can't recover. It could be the person's age. Someone in their 90s we couldn't recover. I always tell people though, don't rule yourself out. Don't decide not to register because you are of a certain age. There might be a research and training program in which we need donated corneas, and that is so important to our process and to help cure the 12 million corneal blind. So don't rule yourself out. The TDC, Transplant Donor Coordinator, has a conversation with the nurse at the hospital, and we ask some further questions, again, to determine whether or not it makes sense to go forward with the cornea donation process. So things that they would be asking is, you know, again, how the person died, did they receive, you know, certain amount of fluids, things like that. So at that point, again, the TDC is determining suitability. The next step, if it makes sense, is to first see if that person is registered or non-registered. Regardless of their registration status, while it's a different conversation with the next of kin, that doesn't necessarily mean we won't, or an IBank wouldn't approach a donor family. This is why I think, you know, it's always so important that the next of kin knows the registration status, and that you as a person make sure that your registration status matches what your wishes are. So at that point, if again, it seems to make sense that a person's suitability, it still makes sense, we will contact the next of kin for a donor risk assessment inventory, or like we call it, a DRE. And that is a medical and social history interview, asking certain things to again determine the suitability. Now, this is the part that we often hear from donor families that they were not aware of and not prepared for, because again, I think this is something that most people don't know about the donation process. Because corneas need to be recovered within 12 to 24 hours after death, these phone calls and these interviews are done pretty quickly. And the federal government says that it has to be an interview. It can't be a survey that the donor or that you would fill out beforehand. It needs to be an interview after cardiac death. So this is a part, again, that I think people are always really surprised about, which is always something that I think is so important that the family is prepared for that phone call. And that donor risk assessment interview, it can take about 20 minutes to a half an hour. And it, you know, the DRE is actually available online. So, and I'll share that in the resources where you can find that. So if you're at all interested to see what that looks like, you can see that beforehand. And your family can see that beforehand. After the cornea is recovered, and it's recovered by specially trained people called eye recovery technicians, then that cornea is further assessed to make sure that it is suitable. And we also do a thorough investigation of medical records to make sure that the donor has nothing that can be transmitted from them to the recipient. And the corneas are also looked at physically to make sure that there are no tears or anything else that wouldn't make that cornea viable for transplant. So again, I am such a proponent for preparation. The things that you can do now is you can make sure that your registration is up to date. You can do that at registerme.org, and you can access your own registration status. The second link is to the one in Washington State. Now, you also probably know that you have that choice to register on your driver's license. You can say yes or no, I want to register. But something that's different than the driver's license is that if you do it online, you can pick and choose what you want to be donated. So when you register, that's saying yes to organ, tissue, and eye. If you do it online, you can be very choosy. You can say, I just want to do corneas, or I just want to do organs and tissue, definitely no to corneas. So I would advise you to go online and do it there. The other thing that I highly recommend is talking about your choice with your loved ones, telling them not only what your choice is, but maybe why you want to be a donor. I think that is such an important step, so they can have a better understanding of where you're coming from. And then the other thing that I highly recommend is, once you're registered, once you discuss your choice, think about who's going to be that conversation, who's going to be that person that has that conversation with Sight Life, who's going to do that, that dray. So for me, for instance, I'm a registered donor, and I don't think my partner would be the right person to do the dray, just because I don't think he would be there. I don't think my mother would, but I think my best friend would be the best person. So I've already told my family and friends it's going to be Trisha. She's going to be the one that has that conversation. So that way, when and if it does come up, people are prepared. It's not a shock. Everybody is set and in place as much as they can be. Of course, again, I just wanted to stress that we do honor our donors and their families, very much so. We do have an extensive donor family aftercare program, and we just had our first donor family event online, because everything is online nowadays. We're able to bring together over 300 donor families to celebrate and honor their loved ones. So again, I highly advise you to learn more. These are links, so when I share this and it's online, you can go there, but you can find all the guidelines behind the FDA, sort of like their rules for donation, as well as the dray, so you can take a look and see what it looks like. The Eye Bank Association of America, that is a great resource just to learn more about eye banking and why we do the things that we do. And then also too, I would recommend going to the National Donor Family Council. Know your rights. Donor families have rights, and if this is something that, you know, maybe someone in your family did already, your friends, or you think you're going to do, definitely go there. This is the Donor Family Council. It was the EBA, the organ people, the tissue people, they all came together, and they came up with certain guidelines. And so I very much recommend that you look at those. Oh, and that is it. Of course, you can always look at sightlife.org as well, and you can learn more about us and our program.
Thank you so much, Rebecca. It looks like we have some questions trickling in.
Great.
Oh, there's so much great information. I have a couple of things that I'd love it if you could give us a little insight on. Sure. I loved when you were talking about communicating with your family about why you want to become a donor. That is such a great suggestion. We suggest for lots of families when they're having discussions about death care and funerals that writing a value statement is sometimes almost more useful than giving them a concrete step-by-step plan, because things happen, and sometimes you got to find a compromise. So if you can understand the process and what those feelings are based in, it can be really such a relief.
I love it. Yes.
Such a big fan of that. Let's see.
Me too.
That open, honest communication. We love it. So when you're talking about trying to decide, who's the person that's going to make these choices for me, that's really good that you mentioned that maybe the person you normally would lean on, like a partner, might not be the right person. How would you document who you would like to do that? Would that be part of your POA for healthcare?
Yeah, I definitely would. Yeah, for sure. I mean, I had that conversation, but that's a really good point, even to me, that I should be more official about it. But yeah, that could be it. Yeah, have it written down somewhere, if not told. And who knows, that may change. And I know with a lot of the things that you do, like, things could change. So make sure that that decision is current too.
That's a good point. So it takes a little bit of maintenance to make sure all those documents stay current.
Yep.
Well, I'd love it if you maybe would say a little bit more about the donor family aftercare program. I think that you did give it short shrift. You were just mentioning an event that you're working on right now for those families. I think that might be something that would mean a lot to the members to hear more about.
Sure. So like I said, we have an 18-month program, and that's just like communication that we send to our donor families. We do provide outcomes. So when we can, we provide age and gender and general location of the recipients. Yeah, or if it went to research and training, perhaps maybe it wasn't viable for transplant, but there's a medical and research program the corneas were donated to. And then we just continue to follow up with the family, providing resources and opportunities to connect. So one thing that we have is a donor family Facebook page, which we have like a little over 700 members. And it's just a really great way to come together in community and talk about their loved ones. We share pictures and stories and other things, and support. And it's a really great place. We started doing virtual gatherings as well, smaller ones where we just come together in small groups and talk. And I was telling you before that we're going to try our first craft night.
Oh, I love it.
So the donor families are coming together and we're going to do crafts. And so we'll see how that works. But we're always looking for different ways that we can honor their loved ones and just come together as a community. And then we usually do have these in-person events with our donation partners, such as Life Center and LifeNet and Gift of Life. Unfortunately, this year we were not able to do that. But we're hoping that maybe we can do that in 2021. But if not, we'll figure out a way to do it online.
That's wonderful. We get lots of phone calls from people interested in ironing out the finer points of being an organ donor and looking at cornea donation. And we hear from a lot of families that sense of service and connection and things is one of the greatest value points that they find. So it's wonderful to hear more about what that continued relationship looks like.
Oh yeah, yeah. It's a special group of people, Yeah.
Well, let me take a look here. It looks like we still have about 14 minutes. So if you're holding on to a question, please drop it in there. I mean, we're here just to make sure you all have the information you need to make good informed choices. So let's see who we've got over here. We have a participant that says about 20 years ago, they themselves started having cloudy vision and their eye doctor put prescription lenses in their eyes. What part of the eye did those lenses replace? That wasn't a cornea transplant, was it?
So the lens is a different part of the eye. That
it kind of lives behind the cornea, right?
Yeah, yeah. When I was a nursing major, well, one of the 3 times we dissected an eye, but it's like the part that has more to do with whether you're farsighted or nearsighted and things like that. That's actually one thing I should bring up, is your current vision doesn't really discourage you from being a donor, so a cornea donor. So if you have to wear glasses, and I love when I hear this, but some family members are just so amazed that their loved one is able to donate corneas because they had glasses thick as Coke bottles, and yet they could still donate because that doesn't impact their ability for cornea donation.
That's wonderful. So people really shouldn't exclude themselves without having a discussion with y'all.
No, do not rule yourself out.
That's wonderful. Oh, so as an eye bank though, you guys are recovering other types of tissue as well. It's not just corneas. I think I was reading you guys also do eyelid reconstruction and things like that. Is that right?
So yeah, there are other parts of the eye. So sometimes there is whole globe donation.
Wow.
And that is something that if something comes up, we ask the family. That would be something that would come as a surprise to the family at all. But there are parts of the eye that can also be used for donation, such as sclera, which is the white part of the eye. So that can be used for reconstruction. And we see that being used in people of all ages. So that would be a reason why you would need a whole globe. But we don't recover anything that is not eye related.
Okay. That's wonderful. So even for folks that don't maybe have the best corneas, there's still ways that they can contribute meaningfully to reducing poor vision. That's wonderful.
Yep.
Okay, well, okay, no one's chiming in. This is just about the shyest group of participants we have ever had.
You did such a thorough job.
I think that's absolutely a reflection of that. You've covered every base. But to wit, though, I wonder, with as much communication as you do in your job, is there a question that you wish that more folks would ask you, like maybe a point of interest or just kind of a blind spot, if you will, in maybe just like the general knowledge from the public?
Well, I think a lot of the general knowledge of the public is how the donation process works. I mean, again, it's, the biggest comment I get from donor families, I mean, they're elated that their loved one is able to donate, but the surprise at the timing of the phone call, that phone call from us is going to come shortly after. And I just wish that people were more aware that they're going to get that call. And then I also think too, like if a family member wants somebody else to do the interview, like that's okay. Just like tell us, like I want such and such to do this interview, not me. And we'll do that. We'll be flexible.
That's wonderful. So it's very donor centric, the whole process.
Yeah. Well, donor family centric. Yes.
Of course.
Yeah.
No, it's a good reminder for us all to advocate about our end of life choices and make sure we have these sometimes kind of sticky conversations with our family, because you can't put a price on the value of that.
Yeah. Yeah.
Well, I just don't know what to do about the crickets that I'm hearing. You really must have just covered every little thing. So thank you so much, Rebecca. I learned so much even from this, and I have a medical background, so I came into this a little cocky, admittedly.
Oh, interesting.
Thank you so much for your time and your expertise. This has been a long time coming. We get lots of requests from our members to learn more about this, so we appreciate you joining us. And I'll be sending out a follow-up email to our registrants to make sure they have a copy of your presentation with the slides. I'll go ahead and share your contact information in there in case they do have some follow-up stuff, as well as our contact information. Yeah, I think that's just about everything. I think I'll let you go a few minutes early.
All right. Well, thank you all so much.
Oh no, thank you. It's been a pleasure. Thank you everyone for joining us.